Someone was kind enough to ask a question that I hear all the time. Do I need a breast lift? It's such a tricky thing, and no one walks into the office saying, hey, Dr. Pyle, can you put some scars on the front of my breast that will be noticeable and below the areola and visible? In other words, like, nobody wants a lift when they start talking about implants first. But it's a really useful procedure. And whether or not a person needs a lift depends on what we're trying to achieve. Because a lift can be done for multiple reasons. One is if the breast is sagging and if the nipple sits below the center of the breast, a lift can be used to reposition the nipple or the breast tissue over the top of an implant or without an implant. It can also be used primarily to change the shape of the breast. Over time, as things happen and life happens, the breast tends to get sort of an elongated U shape to it, when perhaps the ideal shape for a breast would be a shorter C shape. So even someone who may not obviously need a lift may benefit from the reshaping that happens with the lift, not just the lifting that happens with the lift. So if the question is, do I need a lift? It's hard to know exactly how you would determine that except for seeing somebody that you trust as a plastic surgeon in their office. Some people say if you stand in front of a mirror and you raise your arm up above your head and your breasts are where you want, then a lift might be necessary or might be useful. If you don't quite get there by doing that, then it is most likely to be useful. And if you don't need to do that to get the breast where you want it, then it probably isn't useful.